Community care is up for debate, and veterans need to know the good, the bad, and the efficient. I will save my reaction for the end. Next up, the Secretary of the VA.
With the course of that over your tenure here, coming out of the pandemic, where the community care part was, I guess, thrown a statistical curveball there. How do you feel VA is in terms of its use of community care? Do you think you found the sweet spot? Do you think it needs to change? Obviously, there are people who are claiming that that would be a way to cut VA budget, would be to lean more on the community. I just wanted to give you a chance to talk about that big picture,
Yeah.
please.
Well, you want me to talk about my feelings? Leo
And your
wanted me.
legacy,
Yeah.
please. Will you just
Yeah.
please talk about your legacy?
Yeah, that will happen exactly never. Leo wanted me to talk about all my private
You gave it
conversations,
to Leo. Anyway.
so that's good. So let me just establish three things. One, I won't talk about my private conversations. Two, I'm not talking about my feelings. And three, if you ask me, am I concerned about something? The answer is always yes. On community care, kind of how we think about this is, in the first instance, not that interesting, right? In as much as the statute has requirements, we follow the statute, and we're a country of laws, so I don't want to suggest that there's something more important than the laws, but veteran satisfaction is exceedingly important to how we provide care at VA. It is the most current, the most up-to-date, I guess, that's the same as current. It's the most up-to-date assessment we can get about a veteran's belief about what's happening in the system. And right now, on outpatient care, we're at 91.8% in the system. So that tells me that veterans, in large measure, feel good about what's happening. There's a remarkable story, or just collection of bullets. I don't think they write stories, by one of the news agencies last week about their belief, their aggregation of Americans' views of their health care access. And this is civilians. And the civilians' views as compared, no, it's not apples to apples, right? They're different measurements, but they're nowhere near 91.8% veteran satisfaction in the civilian sector, right? So that 91.8 is a really important thing for us. Also important are health outcomes. And, we do a lot of long-term data analysis in the health side. We feel really good about what veteran access and veteran care in the direct care system means for veteran outcomes. And so those, I guess, if you were to say to me, how do you feel about community care, I would use those things to answer any question about healthcare as the kind of the guiding lights, which is, I feel good, but there's inevitably more, no, not but, and there's inevitably more work to be done. Last point. There is, though, a big question for the country to resolve, which is, what do we want this system to be able to do? And that, I get the sense that that's a debate that, will continue to move along here. But we should just be really clear with veterans and with the taxpayers about what we mean by that when we do it. I think it would be a shame to lose the strength of this VA system, given all the data I just talked to you about, in terms of what it does for veterans, and importantly, for what it does for every other American. We saw that very profoundly in the context of the pandemic, where our providers cared for, kept alive civilians who would not have had access to health care otherwise, and VA innovations on care, VA research about care routinely impacts outcomes for veterans as well as non-veterans. So, if we want to move away from a system that, has 400,000 VHA professionals, a system that, 75% of healthcare providers in the country have some of their doctors in the country have some of their training in a VA system. If we're going to move away from that, let's make sure that we're leveling with the American people on that, and make sure that we have a system to make up for the roles that VA plays. I think that would be a shame.
There are a few things that the Secretary discussed, and a few articles in the news that have the talking heads throwing out ideas to see what of their shit will actually stick on the wall. There is no doubt that healthcare costs are a wicked problem. I myself have used community care. Little story, I was waiting for over a month to get a dental appointment. When it was a week out, they called to cancel. The dentist had an issue. Instead of waiting a couple more months, I requested community care. It was approved, and I saw a dentist down the street within a week. Community care works, but that doesn't mean please shut down my local clinic. I retired from the Marine Corps, so my wife and I have TRICARE. Because we live close to Camp Pendleton, I have to go to one of the clinics on base, not even the main hospital. My PCM changes multiple times a year, so I just quit going to them. Who do I see for healthcare? I have had the same PCM at the local VA clinic since I got my blue ID. That's where I choose to go. On the other side, I do hear that not all states' VA clinics are on point, but hopefully those locations will be the selected for improvements or efficiencies when the time comes. On to the talking heads. Most of you have probably already read this BS from The Economist, with no author, by the way. Absurdly generous benefits my ass. Whoever wrote this article seems to be surprised that veterans from Vietnam, Desert Storm, and OIF/OEF would start using their earned benefit, especially when the VA opened the door that was previously slammed on veterans' faces with the creation of the PACT Act. Check out my other video on the PACT Act if you have time. On the other side of the coin is a Doge coin, crypto, Doge. There you go. The Department of Government Efficiency, or Doge, could have their sights on the VA. I think they're going to go after some other fish, but let's play. As veterans, we know that the government loves to waste, and a more efficient VA and overall government would be great. We just have to fight to make sure that a ghostwriter from The Economist and efficiency hounds do not send veterans' benefits back to the deny till they die. Thank you for watching. Keep an eye out for more videos on topics from the December 12th press conference.